Hello everyone, this is Nilanjana coming to you with a video on the nose. I've been a doctor for the last 25 years and a GP for the last 20, and I have seen a few nasal problems in my time. In this video we will be dealing with nasal bleeding and nasal polyps, and there will be another video dealing with nasal discharges. Nasal bleeding is by far the most common and by far the most concerning problem with the nose. We have parents of young children presenting with nasal bleeding in the children, and this leaves them very worried because the child has maybe bled in the night and they sustained the pillow, or maybe the child has bled in school and has been sent home from school, etc. When I see a child with nasal bleeds, the first thing is to make sure that the child has not developed a temperature, the child is well hydrated, etc. And the next point is to make sure that the child has no other problems like a bleeding problem or a coagulation problem. Also, it is important to check inside the nose to make sure that there is no active bleeding going on inside the nose. So if I look inside the nose, I might find some old crusted blood inside, but nothing else. So then the advice is to wash the nose 3 to 4 times a day and apply a Vaseline based antibacterial cream. Once the child starts drinking plenty of water, washing the nose and applying the cream, this usually clears the problem, and at this point nothing else needs to be done. However, if the bleeding continues in spite of hydration, washing the nose and applying the cream, then the child needs to be referred to the local ENT department for cautery of the bleeding point. Cautery of the bleeding point is done by a silver nitrate stick and does not cause any pain or discomfort to the child. Usually this is where the bleeding ends, and we do not see any further bleeding after a silver nitrate cautery. In some unfortunate cases this can recur, but is usually then dealt promptly with by recauterizing the bleeding point. In case of adults, however, the nosebleed is completely different. Adult presenting with a nosebleed, I will be checking their cardiovascular status seriously. I will be checking their blood pressure, including a check of the inside of the nose to see why and where they're bleeding from. Most often the nosebleed in an adult is due to a raised blood pressure, and this needs to be handled straight away. Most often, controlling the blood pressure adequately with medication, washing the nose, maintaining good hydration, and applying the Vaseline based cream inside the nose will control the nosebleed in most adults. If the nosebleed is not controlled by the above measures, then they need to be referred to ENT for further measures to stop the bleeding. After this bleeding has been stopped, then the patient is sent back to us and we keep an eye on their blood pressure and on any other symptoms that they might develop. Usually this is quite uneventful, and patients continue living their normal lives, and it's generally nothing to worry about. We now come to the topic of nasal polyps, which are not as common as nasal bleeding, but is nevertheless quite well appreciated and quite commonly seen in the ENT population. So nasal polyps are little mucus lumps inside the nose. Most often the patient will come and say that, "Doctor, I cannot breathe through my left nostril. It has forever been blocked. I've tried this spray and that spray, and I've tried this drop and that drop, but it doesn't work. The left side of my nose just does not work." So after this sort of history, when I look into the inside of the nose, I can see a few lumps inside the left side and the right side of the nose. However, the patient is able to breathe through the right side but is not able to breathe through the left side of the nose. Sometimes in an infection, the inside of the nose can get swelled, and these are the swollen turbinates. These are not polyps. The polyps are soft, boggy and pale swellings at the back of the nose, and the turbinates are inflamed and they are usually in the front of the nose. The other way to demarcate between a polyp and an inflamed turbinate is to try to touch the turbinate. So the turbinate is going to be very, very tender, whereas the polyp is completely non-tender. In a patient with nasal polyps complaining of not being able to breathe, we try and start them on a steroid nasal spray. So we ask the patient to wash the nose and then apply the spray twice a day. The spray helps damp the inflammation inside the nose and also helps to reduce the size of the polyp. This helps the patient breathe, and we also refer the patient to ENT for removal of the polyp, also called nasal polypectomy. We have now covered two topics relating to the nose. We've covered nasal bleeding and nasal polyps. The next video will be nasal discharge. If, however, you have any comments, suggestions, queries about the topics I have discussed here today, please feel free to put your comments or queries in the comment box below. I'll try my best to answer all your concerns. Thank you for watching and have a lovely evening.